The news breaking on coronavirus. Chances are you're thinking more about your health care than ever before. And get this staggering number. More than 25 million Americans have no health insurance of any kind, and cost a huge factor.
But now a brand new company is hoping to completely shatter the traditional health care insurance model, making health care cheaper and easier to understand. Tonight, consumer investigator Bill Spencer shows us a new way to buy health insurance.
So here's my son Trey. He's running at a track meet or a cross-country meet, I believe it was.
J.J. Holly, a proud father from the Woodlands, watches video of his 20-year-old son Trey racing down a running track.
Is he pretty healthy, your son?
Yeah, he's still pretty healthy.
But with Trey living away at school, J.J. soon realized his son would need health insurance. But when he checked the price to add his son to his insurance coverage, he learned it would be $600 a month for a healthy young man.
He needs to be covered. What are we going to use?
That's when JJ discovered a brand new kind of health insurance company called Sidecar Health that offers health coverage up to 40% cheaper than traditional health plans.
We were able to go from a potentially $600 a month bill to health insurance for him that would be $180 a month.
We started Sidecar to lower the cost of health insurance for everybody in America.
Enter Patrick Quigley, who created Sidecar after he was forced to pay $1,300 for an MRI through his traditional health insurance. A few weeks later, he needed a second test, but this time decided to pay for it himself in cash.
I happened to ask the office, hey, can I just pay for this cash? It'll just be easier for me. And they said, sure, it'll be $330. And that blew my mind that at the same location with the same doctor, I could pay $1,300 through my traditional insurance, or I could pay $330 cash.
That's when Quigley started Sidecar Health, an insurance company that eliminates a mountain of paperwork by giving every member a Sidecar credit card that they use to pay their doctors directly at the time of service. So how does that save you money?
The providers don't have to deal with the back and forth with the traditional insurance company. They don't have to send paperwork back and forth. They don't need to argue about what something's covered or how it was billed. They just get paid. It's cheaper for the doctor, so it's cheaper for the patient.
I want to join Sidecar Health. What do I do?
Well, the first thing you do is you come to our website.
On the website, Quigley shows us the price of 3 standard plans for an average 30-year-old male with no major health problems. The budget plan costs $165 a month for exactly $10,000 in health coverage. The standard plan is $199 a month for $25,000 in coverage, and the premium plan costs $279 for up to $2 million in coverage a year. Sidecar covers up to 170,000 medical procedures. It also shows you what that procedure should cost and what Sidecar will pay, so you know exactly what you'll have to pay out of pocket. And one more thing, Sidecar shows you a map of what different doctors in the area are charging for your procedure, so you can shop for the very best price.
Dr. Ramirez is charging $74 to go do a typical office visit. And again, we pay a fixed price of $143. So that if you go see Dr. Ramirez, you're getting about $70 back in your account for next time.
Sidecar does the same thing with pharmacy prices.
Look at the variation of what our members can expect to pay here. I mean, it's everything from $96 if I go shop at this particular pharmacy, all the way to getting $8 cash back to my account if I go shop at this pharmacy.
As for JJ, he figures he'll save more than $5,000 this year going with Sidecar instead of traditional health insurance. And he knows exactly what his son will be getting for that money.
He gets 25 grand worth of coverage. So if he gets a sinus infection, he can go to the doctor, he can use that card, he can swipe it, pays the cash price, he's in and out.
Now, you should know that Sidecar Health is not for everybody. It's geared toward people who don't already have health insurance through their employer. And you need to realize the limitations, meaning if you buy $25,000 worth of coverage, you will get exactly that, $25,000 to spend on health care for the entire year, and that's it. After that, it's all out of pocket. If you want more coverage, you can buy more coverage. Finally, remember, the price you pay for Sidecar will be custom tailored to you and your needs.
All right, so the big question here for traditional, you've got in-network, out-of-network. What's the deal in this case?
In this case, you get to pick whatever doctor you want. You don't have a network to worry about. And also, you really don't have to worry about surprise medical bills later on,
right?
Because you're paying for the procedure at the time of the procedure. It's paid for, it's done.
I love that concept of an allocated amount, and then you get a credit back in your account if you do some budget shopping.
Yeah.
Brings music to my ears.
To all of our ears.
It's great. Thank you.
Yes.
Wonderful story.